Okay, so if you're a student in pharmacy or medicine, you know the feeling. The world of drugs can feel totally overwhelming, just pure chaos. But what if I told you there's a key to unlock it all? Well, you're in the right place, because today we're handing you that key.
I mean, just stop and think about that for a second. There are literally thousands of medications out there. From a simple painkiller you grab at the store to a highly specialized cancer drug, they all need a place. So how in the world do we organize this vast global pharmacy?
Well, the trick is to think about our global pharmacy like one gigantic library. And, to find the right book on the right shelf, you can't just wander around hoping for the best, right? You need a system, a universal cataloging system.
So here's our game plan for this library tour. First, we'll introduce the drug code itself. Then, we'll decode the system behind it. After that, we'll take a quick tour of the most popular sections, and I'll even show you a brilliant shortcut for identifying drugs. And finally, we'll wrap up by talking about why all of this is so important.
All right, let's dive right in with the drug code. What exactly is this system that brings order to our global pharmacy?
Okay, so it's called the Anatomical Therapeutic Chemical System. Yeah, it's a mouthful, so we just call it the ATC system. This thing has been maintained by the World Health Organization since way back in 1976. It's basically the official Dewey Decimal System for every single active drug substance out there.
But how does this code actually work? Let's crack this thing open and see how beautifully logical it really is.
So the ATC system has 5 different levels. The easiest way to get this is to stick with our library analogy. Level 1, that's the floor you're on, the major body system, like cardiovascular. Level 2 is the specific aisle, say for blood pressure meds. Levels 3 and 4 get you to the exact bookshelf and even the section on that shelf. And finally, level 5 points you to the specific book itself, the individual drug.
All right, let's make this real. Let's take a super common painkiller, paracetamol, which has the code N02BE01. The first letter, N, tells us we're on the nervous system floor. N02 takes us to the analgesics aisle. N02B narrows it down to the other analgesic shelf. N02BE points to the chemical family, the analydes. And boom, N02BE01 is the unique code for paracetamol. See? From a huge system to one specific drug in 5 simple steps. Okay, so now that we've got the decoder ring, let's take a quick walk through the library's bestseller aisles. These are some of the most common therapeutic drug classes you're going to run into, guaranteed. First stop, Analgesics and Anti-inflammatories. Their job is pretty straightforward. Relieve pain, cut a fever, and fight inflammation. A lot of them do this by blocking an enzyme called cyclooxygenase, or COX. And the classic examples you definitely know are ibuprofen and, of course, paracetamol. Next up, let's talk about anti-infectives, like antibiotics. These guys are our frontline fighters against bacterial infections, and they have different strategies, which is pretty cool. For example, penicillins work by smashing down the bacteria's cell wall, while others, like tetracyclines, stop the bacteria from making proteins it needs to survive. Now, heading back to that nervous system aisle, we find drugs like antidepressants and anxiolytics. As you know, these are for treating mood and anxiety disorders. A really important class here is the benzodiazepines, which includes widely used medications like lorazepam and midazolam. All right, let's move to the cardiovascular section. These drugs are absolutely vital for managing things like heart function and blood pressure. One of the key groups here? Beta blockers. They work by blocking certain signals to the heart, which helps to slow it down and lower blood pressure. You've probably heard of metoprolol and atenolol. Of course, this system covers the whole body. For the gastrointestinal tract, you've got drugs like omeprazole, which tackles acid reflux, and then for the respiratory system, there are things called bronchodilators like salbutamol, which help open up the airways during an asthma attack. And our tour ends with endocrine and metabolic drugs. These are essential for regulating hormones and metabolic processes. The most famous example, of course, is their use in treating diabetes. In fact, the WHO itself uses metformin as a key example, right alongside the life-saving hormone insulin. Okay, now for what might be the best part. I'm talking about a genuine lifesaver for your studies and exams. This is a pattern recognition trick that is going to save you so much time. You know that feeling, right? You see some super long, complicated generic drug name, and your brain just freezes. How are you possibly supposed to know what it does without memorizing every single one? Well, guess what? You don't have to. The secret is in the ending, the suffix. The generic names of drugs in the same class almost always share a common stem. So you see a drug ending in "cillin," you know it's a penicillin antibiotic. If it ends in olol, you know it's a beta blocker for the heart. Ends in azepam, that's a benzodiazepine for anxiety. Seriously, this simple trick is like having a pharmacology superpower. It lets you identify a drug's class and what it does instantly.
Okay, so this system is pretty cool, and that study trick is awesome for sure. But why does any of this matter in the real world? Beyond just passing your next exam. What's the big picture here?
Believe me, this is so much more than just a quiz topic. The ATC system is the backbone of global drug statistics. It lets researchers and public health officials all over the world speak the same language so they can track drug use, compare data, and ultimately make medication safer for every single one of us.
And honestly, this quote from the World Health Organization just says it all. The goal is simple, but it's incredibly powerful. Use this shared language to get better at how we use medicine, all across the globe.
So, if there's one thing you walk away with today, let it be this. Every single one of those codes is way more than just a label. It tells a story, a complete story about a drug's purpose, from the massive system it affects all the way down to its very specific chemical identity.
And that brings us to our final question, a big one to think about. As science keeps pushing forward and we develop these incredibly complex and targeted new drugs, how is this system going to evolve? What's the next great challenge in organizing and understanding our ever-expanding global pharmacy? Thanks for joining me.